Do you think it's really possible to have a patient who comes in with severe symptoms like chest pain, breathing difficulty, racing of heart to the emergency and yet being discharged safely without having a single needle, single test, single medicine given to her? Yes, I'm Dr. Prakash. I'm an emergency physician. My life revolves around these vulnerable moments, these unpredictable moments every day, and I'm here to discuss one such incident. It was around late in the evening when a young woman walks into the emergency saying she's got severe chest pain, breathing difficulty, racing of heart, she's profusely sweating, and in the triage she had an ECG done which was absolutely normal. As I was speaking to her, she started crying and she was not cooperative to talk. Then I stood there waiting for her to talk, and then at one point I realized she was not crying because of the pain or the breathing difficulty, because as I was talking to her, I had observed that she's breathing normally, her oxygen levels are normal, her heart rate is perfectly under control. There's something else seriously wrong with her. Apparently, this woman had recently lost her job. And so after losing her job, it's been quite a few months and she does not have a job, she does not have an income, she does not know how to pay the rent, and her visa is at stake. She may have to travel back anytime because her visa might get cancelled. And these symptoms have been recurring to her over the last 1 month, and she had visited multiple hospitals, multiple emergencies, multiple cardiologists, and everybody said you're normal and you go back. And she came back again to the emergency here for the same problem. But the only thing that I did differently was I spent some time. I spoke to her, I kept talking to her. I finally asked her, why are you in the emergency? She had the fear of dying. She said, I'm afraid that if I'm going on like this, I would die. Doctor, I don't think I'm lucky at all. I'm absolutely unlucky. I've been unlucky throughout my life. These things always happen to me and only me only. I don't know how I'm going to get rid of it. So I told her, although you're in the emergency, you're in the wrong place. You should be in some place else. You should be with a psychologist. She also told me that many people suggested the same, but I don't want to go to a psychiatrist. They would start me on medications. I said, get yourself evaluated. There's something called as a cognitive behavior therapy where they will get to assess you. They will get to talk to you first, and 80% of the time, just by the cognitive behavioral therapy, people recover. Identify the root, identify the cause, and just pull it out of your system and you will be back to normal. Trust me. She was getting along with the conversation and she started to laugh and there are other emergencies walking inside who also are in pain, who need to be addressed. So I'm taking a lot of time with her. It's been around 20-25 minutes that I had to spend talking to her. Finally, I convinced her saying that I will get you an appointment with a psychologist and you need to meet them, and there are some things that you should try to figure out by yourself too, and they will help you with that. She was happy, she was glad that she was here, that she was able to talk it out to someone where she would feel that relief. Now, this is the same situation for most of us, right? Who does not have stress? And many people, different people handle stress in different ways. Many people come out of it strongly, many people don't. Every single thing have questions that arise out of something. Mainly, it is the stressor that causes the effect. And we always ask these 6 questions. Why is this happening to me? What could I have done better? Where did I go wrong? Who did I piss off? Who else should I meet? What should I have done better to come out of this situation safely? How am I going to get rid of my situation and come out and stay positive, come back on top? And there are plenty of answers waiting for all these 6 constant questions. You can pick 1 or 2 of those answers and start working towards those answers. Often it's not these failures. Of course, everybody has failures in their life. There is no success without failures. Yes, most of you know that. But are these failures putting you down? Yes, they will put you down, but it is not the failures that keep you down. It is the fear of rising back up again. There's always a door open and you can step through it, find out if it's working for you. If not, wait. And there is always something which will be waiting for you. You are unique in this world, and this world has something unique for you. Finally, after 25 minutes, I discharged her. I told her, you're fine, you're good to go home, and she was very happy and smiling. As she left the emergency, she went over to the reception there, and what did I give her? No medicines, no tests. It was just simple time. And that's what many people lack here. People don't have someone else to talk to, and majority of them get stressed over and come in panic attacks, come in hyperventilation to the emergencies just because they do not have someone else to talk to. All I gave her was that simple time, and she walked back. She came back a couple of minutes later and I was stunned. I was worried. I'm not going to spend another 25 minutes. No, she came back and said, thank you, doctor, but you told me I have to meet a psychologist, but I don't have insurance. I said, okay, so how can I help you? Since you have not given me anything, any medicines, can you cancel your consultation fee so that I can use that for the psychologist consultation? I said, guess what? Today is your lucky day. I'm canceling my consultation fee and you go ahead and book your consultation.